Question 1. A nurse is caring for a patient newly diagnosed with NAFLD. Which of the following should be the priority nursing action? A. Educate the patient about alcohol cessation. B. Recommend weight loss and lifestyle modifications. C. Schedule the patient for a liver biopsy. D. Administer prescribed vitamin K supplements. Answer. B. Recommend weight loss and lifestyle modifications. Question 2. Which patient would be the nurse's priority when managing a group of patients with NAFLD? A. A 45-year-old with mildly elevated ALT levels and no symptoms. B. A 52-year-old with NAFLD who is reporting right upper quadrant pain and confusion. C. A 36-year-old with recent diagnosis seeking diet advice. D. A 50-year-old awaiting an abdominal ultrasound. Answer. B. A 52-year-old with NAFLD who is reporting right upper quadrant pain and confusion. Question 3. A nurse is delegating tasks for a patient with NAFLD. Which task is appropriate to assign to a licensed practical nurse, LPN? A. Developing a weight loss plan. B. Teaching the patient about insulin resistance. C. Administering prescribed antihypertensive medications. D. Performing an initial assessment. Answer. C. Administering prescribed antihypertensive medications. Question 4. A nurse is teaching a patient with NAFLD about dietary modifications. Which statement indicates a need for further teaching? A. I will increase my intake of fresh fruits and vegetables. B. I can still eat fast food occasionally as long as it's grilled. C. I will reduce sugary beverage consumption. D. I will try to lose 7 to 10% of my body weight gradually. Answer. B. I can still eat fast food occasionally as long as it's grilled. Question 5. A patient with NAFLD is admitted for worsening liver function. Which lab result would the nurse report to the provider immediately? A. AST25U/L. B. Albumin 4.0G/DL. C. 2.1 Indian rupees. D. Total bilirubin 0.9 milligrams per deciliter. Answer. C. 2.1 Indian rupees. Question 6. Which of the following patients is at highest risk of developing NAFLD? A 28-year-old with a BMI of 21 and active lifestyle. B. A 33-year-old with type 2 diabetes and obesity. C. A 46-year-old who drinks wine occasionally. D. A 39-year-old with a history of gallstones. Answer. B. A 33-year-old with type 2 diabetes and obesity. Question 7. The nurse is reviewing medications for a patient with NAFLD. Which medication should the nurse question? A. Metformin. B. Atorvastatin. C. Acetaminophen 4G/day. D. Vitamin E supplements. Answer. C. Acetaminophen 4G/day. Question 8. A nurse is providing discharge instructions for a patient with NAFLD. Which instructions should be included? A. Take all herbal supplements to support liver health. B. Alcohol in moderation is acceptable. C. Increase saturated fat intake for liver repair. D. Maintain a healthy weight through regular exercise. Answer. D. Maintain a healthy weight through regular exercise. Question 9. A nurse is caring for 4 patients. Which patient should be assessed first? A. A patient with NAFLD reporting new onset confusion. B. A patient with stable fatty liver and scheduled labs. C. A patient asking for dietary teaching. D. A patient preparing for discharge with no complaints. Answer. A. A patient with NAFLD reporting new onset confusion. Question 10. A nurse delegates to the Unlicensed Assistive Personnel UAP for a patient with advanced NAFLD. Which task is appropriate? A. Perform a focused abdominal assessment. B. Educate the patient about low-sodium diets. C. Measure and record vital signs. D. Review laboratory results with the patient. Answer: C. Measure and record vital signs. Question 11. Which of the following findings would indicate improvement in a patient with NAFLD? A. ALT increasing from 45 to 60 U/L. B. Weight reduction of 5% over 6 months. C. Increased abdominal girth. D. Onset of jaundice. Answer: B. Weight reduction of 5% over 6 months. Question 12. A nurse is reviewing the chart of a patient with NAFLD. Which history element is most concerning? A. Sedentary lifestyle. B. Occasional ibuprofen use. C. Use of herbal supplements. D. Consumption of energy drinks daily. Answer: D. Consumption of energy drinks daily. Question 13. A patient with NAFLD refuses to follow dietary recommendations. What is the nurse's best action? A. Document noncompliance and move on. B. Refer the patient to a registered dietitian. C. Instruct the UAP to provide dietary teaching. D. Discharge the patient for non-adherence. Answer: B. Refer the patient to a registered dietitian. Question 14. Which complication should the nurse monitor for in advanced NAFLD? A. Hyperthyroidism. B. Hepatic encephalopathy. C. Renal calculi. D. Hypoglycemia. Answer: B. Hepatic encephalopathy. Question 15. When evaluating a patient's understanding of NAFLD, which statement indicates correct knowledge? A. My liver disease is caused by alcohol use. B. I need to stop exercising to avoid injury. C. Losing weight can help reverse my liver disease. D. NAFLD has no known treatments. Answer: C. Losing weight can help reverse my liver disease. Question 16. Which diet is most appropriate for a patient with NAFLD? A. High-carb, low-fat. B. Mediterranean diet. C. High-protein, ketogenic diet. D. Atkins diet. Answer: B. Mediterranean diet. Question 17. The nurse is planning care for a patient with NAFLD and fatigue. Which intervention is most appropriate? A. Encourage frequent rest periods. B. Administer 4 fluids. C. Restrict all physical activity. D. Schedule a CT scan immediately. Answer: A. Encourage frequent rest periods. Question 18. The nurse received a lab report for a patient with NAFLD. Which result needs immediate intervention? A. Hemoglobin 13.2 G/DL. B. Platelets 90,000/mm superscript. C. AST 40 U/L. D. Albumin 3.7 G/DL. Answer: B. Platelets 90,000/mm superscript. Question 19. Which task can the nurse safely assign to a new graduate RN caring for an NAFLD patient? A. Conduct an initial liver assessment. B. Teach the importance of lifestyle changes. C. Insert a central line for IV therapy. D. Prescribe metformin. Answer: B. Teach the importance of lifestyle changes. Question 20. Which action by the nurse best promotes patient safety in advanced NAFLD with hepatic encephalopathy? A. Encourage the patient to walk unassisted. B. Keep the room lights off at all times. C. Place the patient near the nurse's station. D. Avoid all medications to protect the liver. Answer: C. Place the patient near the nurse's station. Question 21. A patient with NAFLD is scheduled for an abdominal ultrasound. What pre-procedure instruction is most important? A. Avoid alcohol 48 hours before the test. B. Fast for at least 8 hours prior to the ultrasound. C. Take your blood pressure medication with food. D. Empty your bladder immediately before the test. Answer: B. Fast for at least 8 hours prior to the ultrasound. Question 22. Which action by the nurse indicates a correct understanding of NAFLD pathophysiology? A. Monitoring for signs of bile duct obstruction. B. Assessing for alcohol withdrawal symptoms. C. Evaluating insulin resistance and metabolic syndrome. D. Checking for viral hepatitis markers. Answer: C. Evaluating insulin resistance and metabolic syndrome. Question 23. A nurse is caring for a patient with NAFLD and new onset ascites. What is the nurse's priority? A. Monitor blood glucose closely. B. Place the patient on a high-protein diet. C. Measure abdominal girth and assess respiratory status. D. Encourage increased oral fluid intake. Answer: C. Measure abdominal girth and assess respiratory status. Question 24. A nurse is teaching staff about scope of practice. Which task is appropriate for the UAP when caring for a stable NAFLD patient? A. Evaluate response to diuretic therapy. B. Assist with ambulation to prevent deconditioning. C. Provide patient education on low-fat diets. D. Administer lactulose for encephalopathy. Answer: B. Assist with ambulation to prevent deconditioning. Question 25. Which lab value in a patient with NAFLD indicates progression to cirrhosis? A. ALT 55U/LB. Platelets 130,000/mm supersphere 3. C. Albumin 2.8 G/DL. D. Hematocrit 42%. Answer: C. Albumin 2.8 G/DL. Question 26. The nurse suspects worsening liver function in a patient with NAFLD. Which symptom supports this concern? A. Decreased appetite and mild nausea. B. Pruritus and jaundice. C. Elevated heart rate with normal BP. D. Mild fatigue after meals. Answer: B. Pruritus and jaundice. Question 27. A patient with NAFLD is prescribed pioglitazone. What assessment is most important before administering this medication? A. History of heart failure. B. Allergy to penicillin. C. Creatinine level. D. White blood cell count. Answer: A. History of heart failure. Question 28. A nurse is reinforcing teaching for a patient with NAFLD. Which statement by the patient indicates correct understanding? A. I need to completely avoid all fats in my diet. B. Even moderate alcohol use is unsafe for me. C. Once I lose weight, I can stop my medications. D. Vitamin A supplements will heal my liver. Answer: B. Even moderate alcohol use is unsafe for me. Question 29. Which action should the nurse prioritize when a patient with NAFLD becomes disoriented and agitated? A. Ask the family to stay and provide comfort. B. Reorient the patient every 2 hours. C. Assess ammonia level and notify the provider. D. Turn on the television to calm the patient. Answer: C. Assess ammonia level and notify the provider. Question 30. Which nursing diagnosis is most appropriate for a patient with NAFLD and severe fatigue? A. Risk for aspiration. B. Activity intolerance. C. Deficient fluid volume. D. Chronic pain. Answer: B. Activity intolerance. Question 31. A nurse is reviewing a low-fat meal plan for a patient with NAFLD. Which meal choice indicates understanding? A. Fried fish, coleslaw, and soda. B. Grilled chicken, steamed broccoli, and water. C. Cheeseburger, French fries, and milkshake. D. Bacon, eggs, and buttered toast. Answer: B. Grilled chicken, steamed broccoli, and water. Question 32. What is the best response when a patient with NAFLD asks, "Is my condition permanent?" A. Fatty liver is irreversible and always leads to liver failure. B. Your condition can improve with lifestyle changes. C. There is no treatment available for fatty liver. D. Only medication will cure your liver. Answer: B. Your condition can improve with lifestyle changes. Question 33. What is the most important teaching point for a patient with NAFLD starting vitamin E therapy? A. Take the vitamin with dairy for better absorption. B. Avoid sunlight after taking this supplement. C. High doses may increase bleeding risk. D. This replaces the need for diet changes. Answer: C. High doses may increase bleeding risk. Question 34. Which physical finding in a patient with NAFLD requires immediate nursing intervention? A. Mild right upper quadrant tenderness. B. Palmar erythema and hysterexis. C. Reports of decreased appetite. D. Dry skin and occasional fatigue. Answer: B. Palmar erythema and hysterexis. Question 35. The nurse is planning care for a patient with NAFLD and type 2 diabetes. What is the most effective strategy to manage both conditions? A. Increase simple carbohydrate intake. B. Encourage a sedentary lifestyle. C. Promote consistent meal planning and exercise. D. Recommend low-protein, high-fat diet. Answer: C. Promote consistent meal planning and exercise. Question 36. A nurse is assessing a patient with NAFLD who has developed pedal edema. What is the best initial nursing action? A. Notify the healthcare provider. B. Elevate the lower extremities and monitor weight. C. Administer a diuretic immediately. D. Restrict fluid intake to 500 milliliters per day. Answer: B. Elevate the lower extremities and monitor weight. Question 37. Which intervention is most appropriate to prevent falls in a patient with hepatic encephalopathy? A. Administer sedatives to help sleep. B. Restrain the patient to the bed. C. Keep side rails up and use bed alarm. D. Encourage frequent walks unassisted. Answer: C. Keep side rails up and use bed alarm. Question 38. Which laboratory test best monitors inflammation in a patient with NAFLD? A. ALT and AST. B. Creatinine and BUN. C. TSH and T3. D. Hemoglobin A1C. Answer: A. ALT and AST. Question 39. A nurse is discussing the role of bariatric surgery in NAFLD. Which statement is correct? A. It is first-line treatment for all NAFLD patients. B. It is considered only when lifestyle changes fail. C. It reverses cirrhosis completely. D. It eliminates the need for long-term follow-up. Answer: B. It is considered only when lifestyle changes fail. Question 40. A patient with NAFLD is on a sodium-restricted diet. Which food should the nurse teach the patient to avoid? A. Fresh green beans. B. Grilled chicken breast. C. Canned soup. D. Brown rice. Answer: C. Canned soup. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.